December 15, 2005 marks the day Malaysia became a party to the World Health Organization Framework Convention on Tobacco Control. Since then, a number of national policies has been implemented as a intentional effort of Malaysian government in the war against tobacco. Firstly, smoking is generally prohibited in public transportation, specified public places and workplaces. Secondly, all forms of tobacco advertising, promotion and sponsorships are prohibited. Thirdly, tobacco packaging and labeling is strictly controlled and regulated to warn about health hazard of smoking and to avoid misleading packaging and labeling. Fourthly, control of tobacco product regulations have been amended several times from 2008 to 2017. According to a study done by Malaysian Institute of Public Health in 2015, smokers make up a 22.8% among Malaysians aged 15 years old and above. The University of Malaya is the public university in Malaysia. In the perspective of current situation of the university, the situation is not much better. According to a cross-sectional study about health risk behavior among undergraduates, about 10.8% of the students has smoked tobacco before. Based on gender, the prevalence of smoking was found to be 26.6% in males, which is much higher compared to 5.3% in females. At the time the study was carried out, 3.5% of the respondents were still smoking. Surprisingly, 94.5% of the respondents are able to correctly name at least one of the risks of smoking. Unfortunately, 69.8% of the respondents claim that they were exposed to cigarette smoke before while in campus. Basically, University of Malaya is a non-smoking campus. We have lots of signboards being hanged around the campus, which clearly indicates that smoking is strongly prohibited in this campus. We have University of Malaya Center of Addiction Sciences to promote and provide multidisciplinary collaborative education, research and services in tobacco control. In spite of that, there are still people found smoking in the hostel cafeteria, the parking lot, and the outdoor park. And this includes some of the students, staff, construction workers, and even visitors. There is no clear mechanism to report people who smoke in the campus, and many people don't even bother to take action against it. And also, there is no clear designated smoking area. This signifies an alarming situation where there is clearly a lack of enforcement and ensuing effort.
The first step we would like to take is to detect the smoker in our campus. We will organize workshops to train the physician the correct technique to perform cotinine urine tests. These tests will be available to all the members of the university, which include students and staff. Through that, we hope to support our target group and introduce them smoking quitting program. Next, we have identified several smoking behavior in Malaysia, which also explain why there are people still smoking despite all the effort done by our government as well as NGO. From a research carried out in 2015, it shows that male more likely than female to have ever tried smoking. The young men and women believe that smoking makes them look more attractive and modern. It also helps them to control weight. They also think that it is acceptable for them to smoke in their age group. However, it is reported that actually men and female are equally notified with the anti-smoking advertisement, and the anti-smoking advertisement show a decrease in positive belief towards smoking among smokers. Hence, we would like to continue the campaign of Say No, which is an anti-smoking campaign initiated by our government in 2004. We will maintain the use of posters in raising awareness and promote smoking cessation. By doing all this, we are trying to create and promote a smoke-free university. We will set up several specific smoking areas in the campus that will be the only permitted area to smoke. Besides that, we want to enforce the implementations of smoke-free transportation policy that strictly inhibit the passengers, including visitors from outside, to smoke.
Okay, the second step would be to identify the smokers. The question is how? Well, our solution is to introduce the screening tests, namely the carbon monoxide breathing test and the cotinine urine test. During the intake of new students, these tests will be made compulsory and will be included in their medical checkup. A positive or a negative result will not affect the admission status of these students. We are advocating for a zero harm policy rather than a zero tolerance one. Hence, the idea is to not punish the students, but to offer them professional guidelines, help, and tips to give them an opportunity to quit their smoking habit effectively. The carbon monoxide breathing test. Essentially, tobacco contains high amounts of carbon monoxide, a substance that deprives the body of oxygen. Carbon monoxide is a poisonous gas, and compared to oxygen, it has a higher affinity to hemoglobin by at least 200 times. In this test, all you need to do is just take a deep breath, hold the breath, and exhale. Carbon monoxide levels in the body would be displayed on the spot. For long term, this is a very useful tool for smokers because as they began to quit smoking, they were able to chart their progress over time. Cotinine urine test. Nicotine in the body is metabolized in the liver into cotinine. This test is done by collecting urine, blood, and saliva samples. Our first choice would be the urine sample, as it is not only cost effective, but is also sensitive and the results are obtained on the spot. Take strips and dip them in the urine for at least 5 minutes. Regular tobacco users should have cotinine levels of more than 200 nanograms per milliliter.
We believe that the student task force is the main human resources in the smoke-free campus movement. So we are going to hire the volunteer to actually partake in this movement. So they are going to detect the smokers surrounded them, and if the smokers are showing the willingness to quit smoking, so we are going to launch Workplace Challenge.
Workplace Challenge is the challenge that student task force invite smoker colleague to be partake in the smoker cessation behavior when the smoker declare the willingness to quit smoking. So the colleague will be motivating, monitor and helping him or her to quit smoking. So they can use some rewards mechanism to help the smoker, like treating him or her a meal when the smoker complete the challenge. So it requires the smoker to undergo cotinine tests before and after the challenge as a proof of the smoking cessation. The point will be given at the end of the phases, and the points being accumulated, it can redeem some cash prize such as iPhone. So during the challenge period, the tobacco product can be surrendered to student task force, and the student task force will giving some nicotine replacement therapy, apples, and chewing gum in return to replace and distract the smokers. Tips and information will be given by the student task force during the period. It is intended to create a supportive environment for the smoker to quit smoking.
Basically, to achieve a smoke-free campus is by providing the quit smoking program. The quit smoking program is divided into two, which is the pharmacological options and also the non-pharmacological treatment. The pharmacological treatment such as the nicotine replacement therapy, which consists of various types of forms. Nicotine replacement therapy comes in various forms such as nicotine gum, patches and inhalers. Second is bupropion, which also known as Zyban. The combination of these and nicotine patch has been found significantly increased in long-term cessation. Non-pharmacological treatment. Number 1 patient education and advice on tobacco usage and smoking cessation. Second, a brief physician advice plays an important role. This has been shown to be effective in increasing the likelihood of cessation. Follow-up is a must to ensure a long-term impact. Third, behavioral counseling by trained therapists on smoking cessation. This will not involve in the routine medical care. The follow-up is within 6 months and longer. Fourth, we are proposing a Quit Line, which is a free call service offering smoking cessation tips. This is a proactive telephone counseling which the counselor initiates the client contact. A multiple session of callback counseling would be improves the quit rates. Web-based cessation programs on Facebook, Twitter, and Instagram can be done via the social media. Daily updates on tips and information on smoking cessation will also be updated in the social media. Next is to design a multifunctional app. This app is to detail statistical information about how your quitting is progressing. It is also focused on practical side of quitting smoking, which will tell you how much you smoke and then give you the facts and figures based on the information provided. It is also used to overcome the feeling of worrying and anxiety that often accompany when you're quitting smoking. This would be great for people who feel overwhelmed by their emotions and their addiction. This app also records progress for the token engagement giveaway in the workplace challenge. It connects with smoking support group members. Latest updates and useful tips to abstain from smoking will also be updated. In conjunction with the World No Tobacco Day 2017, which will be in 31st May with the theme of Tobacco, a Threat to Development. Seminar, conferences, motivation talk, and symposium will be conducted. It is a platform for debates, forums, discussion, and sharing session. Our objective is to educate every university members to advocate for smoke cessation movement. We also want to ensure the Empower movement is well understood by all university students. Our main objective is at least 50% of the students understand the concept of Empower.